Time to get ahead and on track? CompCare Medical Scheme can take you to the next level. As a student, you have a lot on the go, and great healthcare cover should be able to slot right into your life and tick all the boxes. First and foremost on the list, reliability and value for money. Not only does CompCare offer the most affordable international student option on the South African market, we also have a proven track record with over 4 decades in service to our member base. So you can rest easy knowing a dependable scheme is in your corner now and into that bright future of yours. With us, you will receive leading-edge preventative care and wellness benefits, while our innovative, well-crafted medical coverage guarantees maximum value to meet your needs and go easy on your pocket. CompCare understands that student life is not only about hitting the books. This is also your moment to soak up the fun while building the foundation for your future. Staying fit and healthy is an important part of that picture. When every cent counts, you can count on us while saving bucks in your budget. Sound interesting? Let's dive in. Say hello to the Networks option from CompCare. Networks has been specifically designed for students and offers essential cover within a specially dedicated provider network for in and out of hospital services. The Universal Network is one of the largest in South Africa and provides you with access to affordable, quality care anywhere in the country. What's more, we have specifically positioned our network of GPs in close proximity to your campus and residence for easy access. CompCare is negotiated and contracted with private healthcare providers, including general practitioners, pharmacies, optometrists, dentists, radiologists, and pathologists, to provide our network's members with access to the very best medical care at the most affordable rates. As you well know, it's important to read the fine print, so let's get started on some of the basics of your cover. When you join CompCare's Networks option, you automatically qualify for unlimited visits to a Universal Network GP, as well as other out-of-hospital benefits within the network, such as dentistry, optometry, and pharmacy benefits. CompCare also covers a chest X-ray for visa purposes. It's important to remember to always ask your treating doctor to refer to the scheme's formulary or medicines list when providing you with the relevant treatment. To find the universal provider closest to you, please contact our call center on 0861 222 777. Should you be unable to reach your network doctor in an emergency, don't worry. We have also provided for a limited number of doctor consultations outside of the network. Likewise, we have you covered with hospitalization at private hospitals in case of emergencies. CompCare believes that you should be able to live life to the fullest. And if enjoying life includes playing sport, we've got you covered. Take advantage of this time to be your best in body and mind. You have full access to our world-class wellness and preventative care benefits at no extra cost. Just some of our wellness benefits include blood pressure, blood sugar, cholesterol, and BMI tests, as well as seasonal flu vaccinations, oral contraceptives, and unlimited telephonic counseling sessions. There's still so much more available to you. If you'd like to get down to the nitty-gritty beyond this video, have a read through your quick one-page Networks benefit brochure. It's good to know that the Networks option cover includes in-hospital benefits, day-to-day benefits, and benefits paid from risk. Let's start with the in-hospital benefits. In-hospital cover is subject to an overall annual limit. The Networks option overall annual limit for scheduled hospital admissions is extremely generous, providing R1.5 million per family for in-hospital costs. Being a network plan, the Networks option gives you full access to private hospitals. In-hospital claims are paid from the scheme's risk pool, and hospital expenses are paid in full at the scheme rate, limited to the overall annual limit. Always remember to obtain pre-authorization for any in-hospital admission. It's also vital to use a hospital on the scheme's list of network hospitals for elective or scheduled procedures to avoid unnecessary costs. All treatment in hospital is subject to case management and scheme protocols. Case management makes it possible for us to provide you with the best treatment in the most cost-effective way, thereby allowing us to keep your monthly membership contribution as low as possible. Some conditions are covered as PMBs, Prescribed minimum benefits are a set of defined benefits to ensure that members have access to certain minimum health services. The aim is to provide people with continuous care to improve their health and well-being and to make healthcare more affordable. PMBs cover the costs related to the diagnosis, treatment and care of specified emergency medical conditions, a limited set of 271 medical conditions and 25 chronic conditions as defined in the chronic disease list. In-hospital benefits provide cover for the following: GPs and specialists, ward fees for general, ICU and high care, theatre fees, medication while in hospital, blood transfusions, oncology, surgical prosthesis for PMBs, clinical technologists limited to 11,500 Rand per family, radiology, MRI, CT and PET scans, pathology, confinements, psychiatric treatment subject to pre-authorization and protocols for PMBs only, organ and bone marrow transplants, plasmapheresis and renal dialysis for PMBs only, cover for injuries sustained while participating in professional sports, and emergency medical treatment for injuries resulting from accidents or trauma. Physiotherapy is limited to 2,600 Rand per family, which includes the combined auxiliary services limit in and out of hospital. Alcoholism, drug dependence and narcoticism treatment is also covered when it is a PMB condition. The Networks option also provides cover for chronic conditions. Chronic conditions are conditions which may be life-threatening if not treated on an ongoing basis with the care and treatment by your network general practitioner. Networks covers 27 chronic conditions, and you simply need to register to become eligible for the chronic benefits. Once registered, benefits are unlimited with no co-payments of levies if the medicine is on the scheme's medicine formulary list and the price of the medicine is equal to or less than the reference price of the product. Medicine not on the formulary will attract a 25% co-payment. You can register by calling us on 0860 111 900 or on the Mobi app. Just to recap, chronic medication is unlimited subject to the network's medicine formulary. These medicines must be prescribed by your treating doctor who is listed as a universal network provider, and the medication must be dispensed by your dispensing universal network GP or obtained from a contracted universal network pharmacy. The generous day-to-day cover on the Networks option is divided into two categories: unlimited day-to-day benefits, where specified day-to-day services are subject to the use of the universal provider network, and day-to-day benefits that are paid from the annual flexi benefit at 100% of the agreed tariff. The annual flexi benefit is a stated benefit amount that is available to you for specialist consultations, specialized dentistry, optometry, and radiology. First, let us unpack the unlimited day-to-day benefits. These benefits are not subject to the annual flexi benefit. Unlimited day-to-day benefits are subject to the use of healthcare providers on the Universal Provider Network and include GP visits, which are unlimited at a Universal Network GP subject to clinical necessity. Clinical motivation may be required to authorize more than 3 GP visits per beneficiary per year. These benefits also include 2 out-of-network visits per beneficiary per year, available with a 20% co-payment. You will be required to pay at point of service for out-of-network GP visits and claim back from the scheme. Benefits per event, including medicines, pathology and radiology, and excluding facility fees, are limited to 1,200 Rand per event. In addition, acute medication is unlimited if prescribed by a Universal Network GP or by a specialist, provided that you were referred by a Universal Network GP. It is also subject to the formulary list of medication. A 25% co-payment will apply if medicine is not on the formulary list. There is no cover for non-formulary medicines unless otherwise pre-authorized. It's important to remember that no cover is available in case of the voluntary use of non-universal providers or voluntary use of a specialist without referral by a Universal Network GP. Basic radiology or X-rays is unlimited when referred by a Universal Network GP, and radiology tests are also subject to a list of specific codes. The same applies to basic pathology or blood tests. It is unlimited, subject to specific codes, and only when referred by a Universal Network GP. Certain day-to-day benefits are paid from the annual flexi benefit at 100% of the agreed tariff. Over and above the day-to-day benefits as mentioned, the Networks option also provides an annual flexi benefit, which is a set benefit amount available to you for specialist consultations, including specialized dentistry, optometry, and radiology. The annual flexi benefit is 3,320 Rand per beneficiary per year and 4,950 Rand per family per year. The following is paid from the annual flexi benefit. Specialist consultations are limited to 2 per beneficiary and a maximum of 3 per family and subject to referral by a universal network GP. Pre-authorization is always required. Referrals are also limited to the use of specialists within designated service provider network hospitals. Another benefit covered from the annual flexi benefit is basic dentistry, which is limited to 1 consultation per beneficiary, including preventative care, infection control, fillings, extractions, and dental x-rays at a universal network dentist. There is a sub-limit of 1,700 Rand per beneficiary, up to 2,850 Rand per family, subject to the annual flexi benefit. Optometry is limited to 1 test per beneficiary every 24 months, including clear plastic lenses for single vision spectacles, and frames are limited to 945 Rand per beneficiary. Bifocals and frames are limited to 1,500 Rand per beneficiary at a universal network optometrist, also subject to the annual flexi benefit. Hospital emergency room or casualty emergency visits for non-emergency consultations are also paid from the annual flexi benefit. And last, but certainly not least, let's take a closer look at the network's wellness, lifestyle and preventative care benefits included in your networks option. Preventative care benefits include a blood pressure, blood sugar, cholesterol, BMI and waist circumference health check, limited to 1 measurement per beneficiary over the age of 18 years and limited to 220 Rand per event at a designated service provider pharmacy. Furthermore, we cover 1 seasonal flu vaccination per beneficiary per year. Other benefits include a rapid HIV test, preventative malaria medication when required, a tetanus vaccine when required, as well as a glaucoma test. We also provide cover for oral contraceptives limited to 145 Rand per beneficiary per month, subject to the scheme's medication formulary. CompCare knows that mental wellness is just as important as physical wellness. We care deeply about this, which is why we've made sure that you have the necessary benefits available to you when you need them most. We offer a 24-hour helpline with trained clinical professionals to help you whenever you need to call in. We also offer face-to-face referral sessions with a maximum of 3 per beneficiary per year. The power of your medical scheme is in your hands with the Member Mobi app, brought to you by Universal Healthcare, administrators of CompCare Medical Scheme. The Mobi app is your mobile gateway to information, allowing you to view and edit your medical scheme option, benefits and claims anywhere, anytime. Well, that just about covers everything. And as you've no doubt figured out by now, CompCare is here for you every step of the way. And if you haven't joined us yet or would like more information, please visit our website studentplan.co.za or drop us a line on 0861 222 777. We'd love to hear from you. Take care from CompCare.